Hello friends. So today we are going to learn about wounds and going to classify it and further talking about its complications. So what is wound? A wound is a break in the integrity of the skin or tissues, whereas ulcer is disruption or break in the continuity of any lining such as skin, mucous membrane or others. Let's classify wounds. According to rank and Wakefield classification, there are two types of wounds. Number A. Tidy wounds, which are caused by sharp objects. They are wounds like surgical incisions. Number B. Untidy wounds. They are due to crushing, tearing, avulsions, devitalized injury, vascular injury, and burns. Based on type of wound. Clean incised wound, lacerated wound, penetrating wounds, abrasion. They are open wounds. Bruising or contusions, hematoma, blunt injury. They are closed wound. Crush injury, traction avulsion injuries, gunshot injuries. They are complex wound. Puncture wounds and bites. Injuries to bones and joints. Injuries to nerves, arteries, veins, and deeper organs. Based on thickness of wound. So first let's see the layer of skin. Here we can see epidermis, dermis, subcutaneous tissue and muscle. If the wound involving only epidermis, it is known as superficial wound. If the wound involving epidermis and dermis, it is known as partial thickness wound. And if the wound with loss of entire skin and subcutaneous tissue, it is known as full thickness wound. And when the wound is extending deeper across deep fascia into the muscles or deeper structure, it is known as deep wounds. Others are complicated wounds which are associated with injury to vessels or nerve, and penetrating wounds which are associated or penetrates into either natural cavities or organs. Based on involvement of structures, simple wounds, which involve only one organ or tissue, combined or complex wounds involving mixed tissues. Based on time elapsed, there are acute wounds that progress through normal phases of healing. Chronic wounds, here healing doesn't occur within the expected period according to its etiology and localization. Chronic wounds are two types. Number one typical and number two is atypical. Based on surgical wounds, they are also known as Berard wound classification, which includes clean wound, clean contaminated wound, dirty wounds. Clean wounds are elective surgical wounds. GI, GU or biliary tract is not opened. The examples of clean wounds are thyroidectomy, hernioplasty, excision, surgeries of brain, joints, heart, and transplant. Clean contaminated wounds, GI, GU, or biliary tract is opened without spillage of contents. For example, appendectomy, gastrojejunostomy, pancreatic surgeries, and biliary surgeries. Contaminated wound (GI, GU or biliary tract) is opened with gross spillage of contents. For example, in duodenal perforation or intestinal perforations, arterial lacerations, emergency appendectomy. In dirty wounds, traumatic wounds, purulent substance contained in the wound. For example, abscess, necrotizing fasciitis, Fournier's gangrene, open fracture, repair, and peritonitis.